Okay, so this video is going to be kind of a progressive coordination, strengthening of some aspects of shoulder stability and control. So if you incorporate some other elements of potential injury, or if you're post surgery of some kind, you want to be very cautious with these movements. You want to be focusing on stability first, and then slowly progressing, very slowly in some cases, into some more free-flowing movements, especially with rotation if the rotator cuff is involved, either by injury or surgery or both. And so we want to be very mindful of those components, and then just pain in general, trying not to push too much of the pain. So here we go. So stability first. So I have this cane here. You can use a dowel or broom handle or whatever you have. Even a TheraCane, if you got one of those, can be used like this for a shorter lever. In another video I showed using like if you're coming around the corner, you can press back into it that way. You can go stride and kind of turn into it a little bit like this. And so what that will allow you to do is leverage as you lift up through your chest and your body, and maybe use a little rotation of your torso, leverage your elbow. It's almost like an arm wrestling motion. And so you can come up here. Now, if that's painful or too difficult for you, you can use the cane or whatever you have here and kind of keep a little tension between your hands and kind of guide that a little bit as you leverage on that corner or wall, whatever you have there. So I'm going to try to demonstrate it here, although it may not look as clean or crisp in the video as what you can see, but I can kind of spiral up through my body as I lift and drive up that way. So I can kind of leverage that way. I can go in reverse, so I can get my outer leg here is forward, so I can get that twist into the wall to drive and lift that way, leveraging through lifting my chest and engaging that core, anchor through those lower ribs and the hip, pelvis, invisible wall behind me that I'm anchoring to in those areas, and I can even look up in that direction. That helps to lift and open the chest, just trying not to do too much. That in mind as well, we can go the other direction, which is going to be more coming back and in that hand. This one's a little tricky because usually you're going to palm back. So if you can't figure out how to leverage that on the back of your hand, that might be a little bit of an issue. But just in general, you got to maybe use your other arm a little more to kind of leverage this way, so you can get a little more of that turning in across your body. But I'm kind of again going to pull back, maybe a little lower for this one into here, because this is a little awkward. Something that maybe eventually you want to be able to do just for, have a full range of motion, maybe a little bit of a stretch. But if that's too pinchy or painful or strenuous there, I would brush right into that one. Maybe a little lower coming across here. So again, using that spiral technique to kind of create a longer runway, and then also kind of leveraging into the wall through my elbow. I'm engaging more into the posterior deltoid, by the way, back here, which versus like getting too much into those rotator cuff muscles, especially if my shoulder is forward. That's like gonna crank in through there. So I pull that shoulder back, engage against the wall there, posterior delt, stabilize from that, and then that allows me to move more freely using my rotator cuff and the actual rotation. So a little more in the stability in the deltoids, more rotation, movement flow from the rotator cuff muscles, and that should keep things more balanced and hopefully less painful as well.